seniors, every year in the United States, more than 94,000 people are diagnosed with a brain tumor, and doctors warn that over 60% of them ignored the early symptoms, believing they were just normal aging or stress. What if the tiny headache you brushed off yesterday is actually trying to tell you something serious? What if the forgetfulness you laughed about last week is your brain begging for help? In this video, we're uncovering the 10 early brain tumor signs most people miss, often until the condition becomes life-threatening. Some of these symptoms start quietly and disguise themselves as simple fatigue, eye strain, or stress, but missing them could be a dangerous mistake. Stay with me until the end, because recognizing even one of these early signs might just save your life or someone you love. Early signs of a brain tumor are often subtle, confusing, and easy to misinterpret, especially for seniors who already deal with sleep issues, headaches, and memory changes. But the earlier these symptoms are noticed, the higher the chance of successful treatment and long-term recovery. The first early sign is persistent headaches that gradually become stronger and more frequent. These headaches often feel different from normal headaches because they tend to get worse in the morning, improve slightly as the day goes on, and may intensify when bending forward, coughing, sneezing, or lying down. Many people assume these headaches are from eye strain or sinus issues, but if they continue for weeks without relief, they should never be ignored. The second early sign is unexplained nausea or vomiting, especially when there is no fever, stomach infection, or food poisoning involved. With a brain tumor, nausea happens because the pressure inside the skull increases and disrupts the normal nerve controls responsible for digestion. When this happens alongside headaches, it becomes a major warning signal. The third sign is vision changes, which may include blurred vision, sudden double vision, worsening eyesight without a clear reason, or seeing flashing lights or blind spots. A tumor growing near the optic nerves can create visual distortion, making daily tasks like reading, driving, or even walking downstairs difficult and, honestly, even dangerous. The fourth early sign is sudden hearing problems, including ringing in one ear, reduced hearing, or unexplained ear pressure on one side. Many seniors think this is just age-related hearing decline, but tumors in the acoustic region can create subtle auditory disruptions long before any other symptoms appear. The fifth sign is tingling, numbness, or weakness in the arms, hands, legs, or face. These sensations often start mild, as if a limb is falling asleep, but they may become more regular and affect one side of the body more than the other. This happens when a tumor presses against nerves controlling movement and sensation. If someone suddenly finds it difficult to button a shirt, lift objects, use a fork, or maintain grip, it can be a silent but serious red flag. The sixth sign is balance issues and dizziness. People may feel unsteady while walking, or like the room is spinning when they stand up. A brain tumor can interfere with coordination, posture control, and spatial awareness. Many seniors think this is just old age catching up. But if dizziness becomes frequent, unpredictable, and unexplained, medical attention is urgent. The seventh sign is personality or mood changes. This one is extremely dangerous because it's often misunderstood. A person may suddenly become more emotional, more irritated, more anxious, depressed, or confused. They may withdraw socially, lose interest in hobbies, or become unusually aggressive or frightened. This happens because a brain tumor affects emotional control centers, gradually altering behavior and thinking patterns. The eighth sign is a noticeable decline in memory, concentration, or speech. Someone might forget recent conversations, repeat questions, lose words mid-sentence, or struggle to express what they want to say. Seniors often laugh these off as getting old, but when memory changes appear suddenly, worsen over weeks, or include speech difficulty, they must be taken seriously. The ninth sign is seizures, even mild ones. Not all seizures look dramatic. Some begin with brief muscle twitching, staring spells, sudden confusion, or strange body sensations. Many adults who develop seizures for the first time later in life are eventually diagnosed with a brain tumor. The final early sign is sudden extreme fatigue, where the person feels exhausted despite sleeping well and notices a dramatic drop in strength, focus, and motivation. This type of fatigue is not the same as ordinary tiredness. It feels overwhelming, persistent, and unexplained. It occurs when the brain becomes stressed, inflamed, and unable to regulate the body's energy properly. By understanding these symptoms early, seniors can give themselves the chance to catch a tumor before it reaches an advanced stage. The most frightening part is that most people wait weeks, months, sometimes even years before seeking help, believing these early signs are harmless or temporary. They fear hospitals or believe the symptoms will fade, but time is everything. When tumors are detected early, 5-year survival rates increase dramatically, while delayed diagnosis brings far more dangerous outcomes. At this point, many people wonder, how do I know if what I'm experiencing is serious or just normal aging? The answer lies in patterns, frequency, duration, and intensity. If symptoms are new, worsening, persistent, or affecting daily life, that's when you must listen to your body. Headaches that don't improve, memory changes that escalate, dizziness that continues, vision that worsens rapidly. These are not random signs. These are signals your brain is sending. In the United States, neurologists report that more than half of patients only receive diagnosis after symptoms become severe, and by that time, treatment becomes harder, more invasive, and risky. That is why awareness is the most powerful tool you have. Even recognizing one single sign early can trigger timely examination, MRI scans, neurological tests, and specialist consultations that can prevent irreversible damage. And remember, not every sign means cancer. Tumors can be benign as well, but ignoring symptoms gives disease space to grow. The human brain is silent, delicate, and honestly unforgiving when neglected. Now that we understand the early signs, the biggest question becomes, what should you actually do if you notice even one of these symptoms in yourself or someone you love? The truth is, most people panic, search online, scare themselves, and then still delay medical care. But action is everything. The very first step is awareness, the second is observation, and the third is evaluation. If you begin noticing persistent headaches, confusing memory changes, or unusual dizziness, start documenting them. Write down when the symptoms appear, how long they last, how strong they feel, and if they are getting worse over time. This record can help doctors analyze your condition accurately. Next, schedule a neurological evaluation as soon as possible. Do not wait months hoping the symptoms disappear. Specialists can perform simple tests that examine reflexes, balance, eyesight, mental clarity, coordination, and sensory response. If anything appears concerning, the next step is imaging, specifically CT scans or MRI scans. These allow doctors to detect tumors early, sometimes when they are still extremely small and easier to treat. Many seniors fear medical reports, but early detection is the #1 factor that improves survival, reduces complications, and increases treatment success. Another crucial point is lifestyle awareness. Many early brain tumor signs appear during periods of high stress, dehydration, poor sleep, or poor diet, making them harder to notice. That's why you must monitor the difference between temporary discomfort and long-term warning. Short headaches from dehydration are normal, but long-lasting headaches that intensify over days or weeks need immediate attention. Another important precaution is talking openly with loved ones. Often, other people notice changes in our behavior before we notice ourselves, such as subtle memory lapses, mood shifts, confusion, or coordination problems. If someone close to you expresses concern, do not take it lightly. Sometimes one honest conversation can save months of delay. When it comes to prevention, although not all brain tumors can be prevented, there are, some well-known habits that can really lower your risk. These include maintaining a balanced diet that's full of antioxidants, leafy greens, berries, and omega-3 fats, exercising regularly, drinking enough water, getting good sleep every night, limiting unnecessary exposure to radiation, reducing smoking and alcohol, and also keeping blood pressure and blood sugar under control. A healthier brain is more resilient, more protected, and honestly, more capable of early recovery. But the most powerful preventative method is awareness. Many tumors, they can grow silently for years before showing symptoms, but once those early warning signs appear, the window for effective treatment starts closing, albeit slowly. This is why education really matters. This is why listening to your body matters. And this is exactly why ignoring symptoms is never wise. When seniors understand what their body is trying to say, they gain power. Power to detect danger early, power to protect themselves, and power to act with purpose. Imagine the difference between someone who waits 1 year to seek help and someone who reacts within 1 month. That single decision can be the difference between major surgery and non-invasive treatment. It's honestly the difference between a long recovery and a short recovery. And it could even be the difference between a life-threatening emergency and complete healing. In many cases reported in the United States, patients later admitted they felt strange early symptoms but ignored them due to fear, denial, or just thinking it was a normal part of aging. But aging does not suddenly cause severe headaches every morning, rapid memory decline, unexplained vomiting, or sudden seizures. These are signals, and signals protect us only if we respect them. For those caring for aging parents, spouses, or relatives, always pay attention to emotional changes, behavioral shifts, confusion episodes, or sudden fatigue. The elderly often avoid expressing discomfort, but their actions reveal it. Watch for unexplained falls balance, instability, or signs of fear about walking alone. A silent disease requires active awareness. And finally, always remember this. The purpose of this video is not to scare you, but to prepare you. Fear is honestly useless without direction, but awareness combined with early action can be life-saving. Every sign your brain sends is meaningful. Every symptom has a reason. Every signal deserves attention. Your brain controls your memories, personality, movements, joy, thinking, identity, and life. Protecting it must be your priority, no matter your age. If you notice anything unusual, don't ignore it. Don't wait. Don't just hope it disappears. Pay attention, get checked, stay safe, and value your health above all. Because in the end, the greatest tragedy is not the disease itself, but the signs we overlook before it is too late. And the greatest victory is catching those signs early enough to save a life.